Very, very eye-opening. And I thank you for your courage and for allowing yourself to be so vulnerable and sharing your story with us.
I went back to Croydon University Hospital. And as I mentioned, because my mouth was severely ulcerated, the doctor that I saw then also said, oh, you've got tonsillitis. And then, of course, with the eyes as well, they say you've got conjunctivitis. But nothing was said to address the fact that there's been a drastic change in a short period of time. My lips now, if we quickly look at the previous slide, my lips have gone from this on the 25th, where they're still pretty much whole but swollen. And then by the 27th, I'm getting cracks. I'm getting, purple pink-like openings in my lip. And in the early hours of the morning, we called the paramedics this time around because I was struggling with breathing and struggling to swallow. And the paramedics, they came and they saw me. They saw me in all my horror and glory. As you see my face here, this is exactly what they saw. As you see my hands here, this is exactly what they saw. My entire body, that's exactly what they saw. And instead of rushing me to hospital, they gave me paracetamol. So in the afternoon of the 29th of August, 2019, I went to the emergency room, or accident and emergency, as we call it here in the UK, and I collapsed on entering the hospital, and they had to resuscitate me. So when I think back to that time, I just felt like my body had given up. I had done what I could in terms of fighting, and my body had given up, and that was it. I think it's so important that I even started creating this resource, this PowerPoint, and documenting my experience, because I believe that more needs to be done to support Black and ethnic minorities in terms of representation. So what rare illnesses like SJS actually look like on a person of color, and the early signs. It's my hope that medical practitioners will look at what I looked like on day one. And should a person of color present similar symptoms to what I look like in day one, that person will never have to go to what I look like on day 5.
Very sorry that you had to experience this. And the thing that strikes me, though, and I'm saying this for the other students that are on the line, I'm one of their instructors. What bothers me is that they did not take your complaint of shortness of breath seriously when you first presented. And that is just like, oh my goodness, how could they have missed that?
On systemic racism in healthcare. And there was another lady in the UK who had Stevens-Johnson syndrome. But on presenting symptoms, and even when I spoke to medical practitioners, they said on her presenting just the first day of symptoms, she was rushed to hospital. But for me, there were countless opportunities for Stevens-Johnson syndrome to be identified and addressed much earlier, which would have, circumvented the horrific experience and the rapid development of symptoms which I experienced. But why is it that my symptoms were only taken seriously when I collapsed and was resuscitated, despite the fact that I've been to many points of medical care, such as hospital on 3 occasions, paramedics have come to see me? Why weren't they able to identify my symptoms or recognize that indeed it was a serious matter? And this is where I say that medical education can no longer treat the study of the presentation of diseases on Black people or people of color as extracurricular. That suggests that perhaps white is the norm and white is the standard, and anything outside of it is abnormal. But actually, a medical education should be inclusive of all, because we're studying to look after human beings. And I looked at the book which British dermatologists use in their training. In the book, there is not one single picture of what any skin-like disease looks like on dark skin. You will not find a single picture. All the photos in there were of white skin. And their slogan, this is the British Association of Dermatology, their slogan is healthy skin for all. But actually, healthy skin for all becomes healthy skin for some when your textbook does not even include what perhaps eczema will look like on a black person versus a white person. And unfortunately, what that does is it means that for the black person, because the presentation of the disease is not in the textbook, whether the medics have been trained using that textbook, it means that there's a delay on their accurate diagnosis. There's no urgency. And then, of course, we have the knock-on effect of, okay, yeah, black people are more likely to die. Black people are more, likely to receive delayed treatment. And perhaps I don't believe that in creating this resource, in creating this textbook, that they intentionally said we're going to exclude black people. I don't believe that's the case. However, what I do believe is that society has very much had white as the norm instead of having human as the norm. And we should push for that more in medical education. And certainly black people, people of color should not have to be at death's door. They should not have to be at the point of resuscitation, nor should we have our pain dismissed because it doesn't look white or sound white. We shouldn't have to beg for our pain to be attended to in a timely manner. And I certainly shouldn't have had to go through that experience. However, I'm grateful that I did because now I have the opportunity to share my experience and hopefully bring about a change.
So again, I'm so sorry you suffered, but thank you for sharing what you went through because it's been incredibly educational.
Is that a big concern, is that symptoms will come back, or is this, once you've been through it, your body kind of has these memory of it?
Exactly what happened to make you want to document so much?
Since your incident, have you found any databases that are more open with people of color pictures?
I haven't. And recently in the UK, there have been a few petitions. There has been a young man who's actually a medical student, and he's been putting together a resource. He's called it Mind the Gap, where he's got different skin diseases, and he's showing what it looks like in a white person and then on the spectrum to darker skin, which I think is absolutely amazing. But I haven't come across any databases myself.
Thank you so much. I think you were very graceful with presenting all these images, and you're such an attentive patient. I feel like you're the exception, and that shouldn't really be the need. We need to be looking out for our patients. But I think something that we've been exposed to recently was pain scales, and how women in general are not taken as seriously in terms of their pain reporting. How did you feel pain was you described eye pain, your hand pain, then your scalp pain. You mentioned you couldn't walk, but you were really experiencing this full body this general pain. Were there any instances where you felt I guess more than others, pain was not really received or properly on their end when they were documenting or whatnot? Or can you talk a little about that?
Yeah, absolutely. I did feel like my pain had been dismissed. I mean, at one point when I had gone to hospital for the second time, I was told sometimes it gets worse to get better. And I latched onto that. I thought to myself, okay, maybe indeed it has to get worse. It has to get to a dire state before it gets better. But that comment shouldn't have been shared with me. It should have been, okay, this is what you're experiencing now, and we're going to do everything that we can to ensure that you are relieved from this pain. And I think also on the flip side, not so much the fault of the medics, but also in terms of a personal self-concept. As a Black woman, there is that, you feel that need to, I need to be strong. I can fight this. I can do this. I've been strong before, so I can do it again. But actually, we need to release that whole, strong Black woman trope. And when we are in pain, we need to say, okay, this is how it's. I feel like I'm about to die. But I didn't use those words. I knew I was feeling it, but I thought, I'm not going to say it because I need to be strong. So I think it's a, two-sided
That's a whole
coin.
Another thing, yeah. Oh my gosh. Thank you for touching upon that. Yeah.
Thank you.
What else should we as medical students do to make sure we get a well-rounded education that is all-inclusive in spite of the current education system?
Oh, really, really good question. I think what medical students could do is, let's say, for example, you're studying a particular disease and you notice that you've only got data that fits the typical norm, which is perhaps white male. try your best to seek out for research that covers, I guess, the hidden, the invisible data. And where the data doesn't exist, then we need more medical practitioners or medical researchers who are willing to research on those groups who perhaps are hidden. And then medical students can use the data as part of their learning. And that's why I really do encourage all of you, like, as you've allowed me to share, and you've been so attentive and been so kind. So, like, I just know that this is the birthing of incredible medical practitioners who will change the world and, like I said, be a source of healing for so many.
Is precious, 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 precious. Beautiful photos and documentation that we can learn from.
Thank you so much for sharing this. This is the part of, I'm very optimistic about personalized medicine and us being able to address this. And education is the first step on our end, and it takes people like you to do this. So thank you so much.
What an absolute honor and privilege to share with these medical students all the way in New Mexico while I'm here in London. 91 in total joined the lecture, and it is such a blessing to have been kept alive for such a time as this.